Welcome back to the Rena Malik MD podcast. I'm your host, Dr. Rena Malik, urologist and pelvic surgeon. Today, we're going to be covering the evidence behind supplements, nutraceuticals for erectile dysfunction. Now, erectile dysfunction is essentially the inability to sustain or maintain an erection necessary for penetrative intercourse. Now, unfortunately, this is exceedingly common. Up to 50% of men over the age of 50 will have erectile dysfunction, and that continues to increase every decade, meaning 60% of 60-year-olds, 70% of 70-year-olds, and so on. Now, we have really excellent treatment options for erectile dysfunction. However, there's still a huge number of men who either don't have access to treatment, have side effects, or simply just don't feel comfortable seeing the doctor to talk about their issues. And so they're looking for supplement options. The reason I'm making this podcast is to help you understand the evidence behind the ingredients you're seeing in these supplements so that you can make the best decision for yourself that's possible. Now, I generally don't recommend supplements because there's very little regulation in terms of supplements. They're very often contaminated by other medications or ingredients that are not on the label, and sometimes that can result in dangerous side effects. Now, this doesn't mean that I don't think that they work. It means that I think it's important to be cautious in terms of what supplements you buy. And if anyone is claiming that this supplement is going to cure you, fix you 100%, then I would steer clear. Now, before I get into the individual ingredients, there is an interesting study I want to share with you guys. It was done in Italy looking at the 27 most common dietary supplements that were available in Italy. And they looked at the number of ingredients in each of these supplements and they gave them a score based on how many randomized controlled trials were available for the ingredients and that supported their efficacy. And they specifically looked at what's called randomized controlled trials. Now, randomized controlled trials are essentially the gold standard study. And what they do is they take a group of people and half of them get the intervention and the other half of them get a placebo. And this is meant to sort of assess, is there a placebo effect, which I've talked about before on my YouTube channel, that may be skewing the results. And so we want to see if the therapy actually leads to a clinically significant difference. Now, while these are considered the gold standard, there are still ways to have bias in these randomized controlled trials, and they're not all created equal. They need to be powered appropriately to detect a meaningful difference. So when they looked at these supplements, they looked at how many of them had randomized controlled trials for the ingredients and if they were positive or negative, and if they reached what's called a minimally effective dose. And so based on if they had randomized controlled trials and if they had the correct dosing, they got a score. And they defined these supplements as to have a higher expected efficacy, lower expected efficacy, or no expected efficacy. And the findings were quite fascinating. So of the 27 supplements, most of them contained a mixture of ingredients, which could be anywhere from 2 to 13 effective ingredients. And they most often contained more than 5. And all 27 of them had at least one ingredient that had no evidence of efficacy in terms of improving sexual function. And 88% of them had doses that were below the minimally effective dose. And 3 supplements had 12 ingredients, and of those 12, 9 had no efficacy at all. And only one of the 27 dietary supplements had an effective ingredient at the right dose. And interesting, the one ingredient that was seen very often that had no supporting literature was zinc. So when they did all these scoring, they eventually found that 8% of the supplements had high expected efficacy, 12% had low expected efficacy, and 80% had no expected efficacy. Now, I can't tell you which supplements these are because they just labeled these DS1, dietary supplement 1, through DS27 or dietary supplement 27. But I will link the study in the description, in the show notes, in the YouTube channel, so you can find the study and look at the ingredients that were included. But this study essentially shows that the large majority of supplements have several ingredients that don't work, are not effective or are dosed too low. And so that's why in this review, I'm only going to talk about single ingredients and the data to support those single ingredients. I'm not going to talk about supplements that have multiple ingredients because we don't know which of those ingredients is actually doing the work that needs to be done to help erections. Men, are you still searching for a solution for your erectile dysfunction? You know, the frustration of pills and injections and pumps. By the time you're ready, the moment may have already passed. You and your partner can no longer enjoy the thrill of spontaneity, and scheduling time for intimacy may be a disappointment. Now, there's a way to be ready in the moment for as long as you need. The AMS 700 implant is a permanent ED solution designed for your satisfaction and your partner's. Happy partners agree, with 92% of patients and 96% of their partners reporting sexual activity to be excellent or satisfactory. So go ahead, live in the moment with our clinically proven, physician-preferred AMS 700. Learn more at edcure.org/RMS. That's edcure.org/RMS. Sponsored by Boston Scientific. Now, before we get into supplements, let's talk about what happens when you have an erection. So in order to get an erection, a couple things need to happen. Your arteries need to dilate and your corpocavernosal muscles need to relax. And so for this to happen, first you need sexual stimulation. You need to see something, hear something, feel something that makes you feel aroused. Then nitric oxide is released from nerve endings and blood vessel cells or vascular endothelial cells that are located in the spongy tissue of the penis. This then activates something called guanylate cyclase, which is in the smooth muscle cells that causes an increase in something called cGMP. This then allows smooth muscle cells to relax and blood to flow into the spongy tissue. Now, PDE5 is an enzyme that breaks down that cGMP that then causes detumescence of the erection. And so PDE5 inhibitors are the medications that help with erections called sildenafil, tadalafil, or Viagra and Cialis, and these essentially work to maintain and promote the erection. So let's talk about individual ingredients. I'm going to start with L-arginine. L-arginine is important because it is converted in the body to that chemical we talked about, nitric oxide, which is the ignition for erections. So when you take the L-arginine, it increases the availability of nitric oxide as well as the cGMP, which leads to improved erectile function. It then causes the blood vessels to open wider and increase blood flow. And interestingly, nitric oxide production is decreased in people who have injuries of those blood vessel cells or the vascular endothelium lining. And this is often caused by things like diabetes, heart disease, or atherosclerosis. And we find that people who have low levels of L-arginine or L-citrulline, which we're going to talk about later, have actually higher rates of erectile dysfunction. So L-arginine has actually been pretty extensively studied. There's been a meta-analysis of 10 randomized controlled trials looking at L-arginine, and they looked at a daily dose ranging from anywhere from 2.8 to 8 grams in men who have mild to moderate ED, and they saw that it improved erectile function compared to placebo. In a more recent randomized double-blind placebo-controlled trial, they wanted to specify what happens if you have mild to moderate versus severe ED. So these guys took high doses of L-arginine for 3 months compared to placebo, and they took 6 grams divided up over the course of the day, 3 times a day with meals. And so they had 51 men who got the treatment versus 47 in the placebo group. So at 90 days, they saw again significant improvements in what we call the IIEF. Now, this is going to come up in a lot of the studies. The IIEF is the most commonly used questionnaire to assess erectile function. Now, it's been validated, which means that the score on this survey correlates with men's erectile function. And And so this is sort of the gold standard used most commonly across all these research studies. So it saw improvements in these scores, but it also saw improvements in peak systolic velocity, which is a measure of how quickly blood flows into the penis. And in fact, 24% of men who had no ED after they started taking the supplement, and those were usually men who had mild to moderate ED. Adverse effects were pretty low, meaning side effects. So headache, itching, and insomnia, and sometimes they had GI issues. So when reviewing this data, it seems that you need at least 5 grams a day. 6 grams is probably the best. If you have abnormal nitric oxide metabolism, meaning that you have cardiovascular disease, diabetes, those sorts of things, you may see the most benefit in terms of taking something like this. Now, a couple cautions. If you have allergies or asthma, it actually can exacerbate your symptoms, so you want to avoid using this or use it carefully. It can also cause liver dysfunction and low blood pressure and might interact with other medications that you use for high blood pressure. Now, the big issue with L-arginine is that it has poor bioavailability, meaning that you got to take it at least 3 times a day for it to work because your body breaks it down pretty quickly. However, this brings us to our next supplement, which is L-citrulline. So L-citrulline is more bioavailable and it's converted into arginine in the kidneys. In fact, oral citrulline is better than oral arginine at increasing blood levels of arginine itself, and it results in a more sustained release of L-arginine and avoids the enzymes that are in the intestines and the liver. And there may be some data that L-citrulline encourages penile muscles to release what's called VEGF, or vascular endothelial growth factor, which improves blood vessel function and may restore healthy blood vessel function in the penis. There's not as much robust data on L-citrulline, but in 2011, they recruited 24 adults with, again, mild to moderate, what they called reduction of penile rigidity. They could penetrate, but it wasn't satisfactory. So these are not guys who are having trouble getting an erection. They just have a weak erection. And they assessed their erectile hardness after taking 1.5 grams of L-citrulline divided into 2 doses for a month. And they were actually their own control. So for the first month, they would take a placebo and then they would take L-citrulline. And they found that in the men who took L-citrulline, they saw an improvement, about half of them, in their erectile hardness score from 3 to 4. However, 2% in the placebo group saw the same change. So it seems like L-citrulline could work, again, for men who have mild erectile dysfunction. Now, the good news is L-citrulline, again, is relatively safe and has few side effects. Next is horny goatweed. Yes, horny goatweed. I love this name. So this is derived from a plant called Epimedium glandiflorum, and it's actually named because they noticed that goats ate the plant and had aphrodisiac effects, and so they called it horny goatweed. Now, the active ingredient in this Epimedium plant is Icarin, and Icarin is essentially similar to a PDE5 inhibitor. So just like the action in tadalafil or sildenafil, it has similar activity. It's also been suggested that it might enhance smooth muscle proliferation and may be beneficial for men who have refractory or treatment refractory ED because of damage of their endothelial cells, like things like high blood pressure or diabetes. This Icarin's also been thought to maybe increase nitric oxide availability, but it also has poor bioavailability, poor absorption, and a short half-life. Now, interestingly, even though you probably see this in a lot of supplements, it's not been studied in a randomized controlled trial. So I don't really have good quality data to share with you. And there's actually some side effects potentially with horny goatweed. It can include things like dizziness, vomiting, dry mouth, thirst, and nosebleeds. And if you take too much of it, it can cause things like spasms and seizures and even breathing problems. So ultimately, based on the fact that there's not a lot of data on this, despite the name being very exciting and sounding very good, I would not recommend taking this one yet. So the next supplement is Yohimbe, and Yohimbe was actually used quite commonly before sildenafil and tadalafil came on the market. Now, it's extracted from the bark of an African tree and it's thought to work by working on alpha-2 receptors and antagonizing them. In 1998, there was a meta-analysis that showed it was generally effective for erectile dysfunction compared to placebo. However, it it has some significant side effects that are concerning, and I'll get into those. And so within the studies, there's about 4 different studies that I've looked at. 3 of them were crossover studies, and meaning that they took some placebo and then crossed over, and it only looked at men with psychogenic erectile dysfunction. And they measured something called nocturnal penile tumescence. And so essentially they wanted to see if men had more erections at night and were they more firm and lasting longer. And what they found was that there was a statistically significant improvement in nocturnal penile tumescence in all of the studies. And they took the supplement anywhere from 10 weeks to 2 months, and they got anywhere between 18 to 36 milligrams of Yohimbe. So as I mentioned, the side effects are pretty concerning, and that can include things like high blood pressure, increased heart rate, manic reactions, bronchospasm, palpitations, insomnia, anxiety, irritability, shivering, sweating, nausea, flushing, and headaches. And this is because it's working on these adrenergic receptors that are in the brain. And so most commonly people are feeling anxiety and agitation, but some of these are really serious side effects. You definitely don't want to take them with any medications that are antidepressants or antipsychotics, or if you have any bleeding conditions, liver failure, renal failure, seizures, diabetes, heart disease. So basically, it's very few people who should even take this supplement as it is. And I would say the data is not really quite that compelling. Now, interestingly, there was a more recent study looking at the amount of Yohimbe in supplements based on what they said on the bottle. Interesting, almost 3/4 of them didn't even label how much was in the actual supplement. And of the ones that did label, the dose could be anywhere from 28% of what they actually put on the label to almost 125% of what they put on the label. So again, really another reason to be weary of some of these supplements. Next one is Ginkgo biloba. Now, Ginkgo is obtained from Ginkgo trees, and it contains things like flavonoids, glycosides, and terpenoids that all have been used for centuries in sort of traditional Chinese medicine. And the mechanism of action has been thought to be that it does some PDE5 inhibition. It may increase nitric oxide bioavailability. However, it's only really been studied in a very specific group of men, and that's men who have antidepressant-induced sexual dysfunction. And what they found was there was really no statistically significant difference, anywhere from 120 to 240 milligrams of Ginkgo in terms of sexual function. Since then, there's been 2 studies, both of which have been randomized, either double-blind or triple-blind placebo-controlled trials, looking at men anywhere from the ages of 23 to 66 years of age. Again, they were taking antidepressant medications. So these are not men who have sexual dysfunction for other reasons. And again, in both those studies, they saw no statistically significant difference compared to placebo. And again, there's a number of side effects. We think that because they're natural, you're going to have less, but you can still have issues like GI issues, sedation, headache, increased appetite, nausea, and even numbness in the fingers. They've also noticed some spontaneous bleeding in people who take Ginkgo, really being thoughtful again about what medications you're taking. You definitely don't want to take it if you have anti-anxiety medications or antipsychotics. So again, so far of all the things we've reviewed, I would say probably the best bets are L-arginine or L-citrulline. Next, let's go into maca root powder. Now, this is a Peruvian plant, a root vegetable derived from the Lepidum mayeni plant. I don't know if I'm saying that right. The mechanism of action is unclear, but it is very frequently used and talked about. And however, there's really very limited data. So there's one double-blind randomized placebo trial looking at 2,400 milligrams of maca daily for 12 weeks on men with ED. And they did see an improvement in those IIEF scores. However, they only saw an improvement of 1.6 points. Now, I don't think I talked about this yet, but the minimal clinically important difference is something that we actually study to find out if you get a change on a survey, how many points does it need to change for you as an individual to notice a difference? And so for the IIEF questionnaire, it's generally based on your baseline erectile function. So if you have mild ED, you only need to change in about 2 points to notice a difference. If you have moderate ED, it's somewhere between 5 and 7 points. If you have severe ED, it's somewhere between 7 and even 12 points. So the more severe your ED is, the higher change you need. So this is even below 2. So likely it's not a clinically meaningful difference. There's also 3 other studies that were double-blind, randomized, either parallel placebo or crossover trials with either healthy men or cyclists, and they showed an improvement in IIEF scores. One of them did. However, the other 2 only saw improvements in desire and not necessarily erectile function. The dosing ranged anywhere from 1.5 to 3 grams per day. Based on this, I would say there's really insufficient data to say that maca has a meaningful difference, but they did notice minimal side effects, and that were things like being a little moody, cramps, gastritis, and insomnia. Next up, let's talk about Panax ginseng or Korean red ginseng. Now, this works by increasing the production of nitric oxide by the vascular endothelium, maybe improving the endothelial function, so those blood vessel cells, and inhibiting oxidative stress and enhancing nitric oxide. It may also inhibit PDE5 and help with some smooth muscle relaxation. So lots of different theorized mechanisms. There's actually been a lot of study on ginseng. There's actually a Cochrane review and 5 randomized controlled trials ranging from 2 to 3 months in duration, anywhere from 800 milligrams daily to 3,000 milligrams daily. And that was a total of about 369 men, 216 receiving ginseng, and 153 controls. And so all of these studies showed a significant improvement in IIEF, and most of them actually met that clinically important difference. And when you did a meta-analysis on these studies, they found a mean difference of 2.67 points between the placebo group and the ginseng group. However, there was some risk of bias in these studies, and so that's what we look at when we do a meta-analysis. We look at, is there bias? And so yes, they did find high risk of bias because there was some missing outcome data in the trial in one of the studies. And in another study, there was very specific results reported, so they didn't report all the results, which then is again another red flag. And so ultimately, even though this has pretty good data, I would say that there are some areas of concern. And again, there are some side effects, most commonly insomnia and headaches. Now, in the Cochrane review, where they included randomized controlled trial as well as what they call quasi-randomized controlled trials, they found a mean difference of 3.52 points. Now, that's higher than what I found in my research, but they called this a trivial effect on erectile function. I think trivial depends on how bad your erectile function is at starting, and that may be really great for someone with mild ED, but not great for someone with moderate to severe ED. Other less commonly reported symptoms can include breast pain, increased heart rate, change in blood pressure, headache, loss of appetite, GI issues, itching, dizziness, or mood changes. And if you have an autoimmune disease or transplant or diabetes or heart conditions, you want to be careful taking anything like this because it can speed up your heart rate and it can interact with antidepressant medications and medications that are processed by the liver. All right, Tongkat Ali is our next supplement. Tongkat Ali, also known as long jack, is named Uricoma longifolia. And it's an herb found in Malaysia, Indonesia, and Thailand. And it's thought to be beneficial for testosterone boosting as well as maybe infertility. And I've actually made a review on this on my YouTube channel. So if you want to just review that data, you are more than welcome to. But today we're going to talk about, as I mentioned, how it helps erectile function. And in terms of sexual function, it's thought that there's 2 mechanisms. One is that it may cause relaxation of the muscles and preventing contraction, and it may have some PDE5 inhibitor mechanisms. Now, there have been 2 randomized controlled trials looking at the evidence for sexual function, specifically erectile function. And in one of the trials, it was a 3-month duration and one was 6 months in duration. And they received 200 milligrams in the 6-month study and 300 milligrams daily in the 3-month study. And they were both statistically significant for improving that IIEF score. However, only the 6-month study met that minimal clinically important difference for men with mild ED, and it increased by 2.82 points. Now, side effects are relatively rare. However, they've found some side effects, including generalized body aches, upper respiratory tract infections, conjunctivitis, ankle pain, Achilles tendonitis, and right index finger pain. Next up is Tribulus terrestris. Now this is an herbal plant that's seen in parts of Greece, China, and India, and it's made of bioactive components called saponins and tannins. And saponins are known to increase nitric oxide activity that we talked about earlier. It may also potentially increase testosterone levels, and I made a video about that as well. That's coming up soon, as well as increase DHEA sulfate levels, and maybe has some PDE5 inhibitor activity as well. So while it's shown some benefit in rat models, in human studies, there's a randomized controlled trial that showed actually no improvement in erectile function or IIEF scores when compared to placebo. After that, there was 3 randomized controlled trials ranging from 1 to 3 months in duration and had about 272 patients total, with 136 receiving Tribulus and 136 in the control group. And in these, they saw a significant improvement in erectile function with a mean difference of 3.88 points. And the minimally effective dose was 750 milligrams daily. Now, again, the risk of bias in these studies is high. It was about calculated at 50%. The other important thing to know is that there have been side effects that are concerning with Tribulus, including renal failure or kidney failure and liver failure. So ultimately, I would say that given the risk of these sort of serious side effects and the potentially conflicting data, I would not recommend it for erectile dysfunction. Next up is ashwaganda. So ashwaganda, also known as Withania somnifera, is an herb, and it grows in India, Middle East, parts of Africa. It's often used in Ayurvedic medicine for stress and immune support and to reduce anxiety and depression. Now, how does it work exactly? Well, it contains active compounds called withanolides, and these are believed to have a variety of health benefits and are thought to potentially have anti-inflammatory, antioxidant properties, which can help reduce oxidative stress and inflammation in the body. Additionally, it's also classified as an adaptogen, meaning that it can help the body cope with stress more effectively. So there have been 2 randomized controlled trials with about 66 patients receiving ashwaganda. Generally, they found no significant difference for erectile function in men with all types of erectile dysfunction that they did in one study. In the other study, they looked at men who only had psychogenic erectile dysfunction. And these men saw an improvement, but they also saw an improvement in the placebo group. And this is sort of telling, right? Because your brain is super powerful. So if you think something is going to help you, even a placebo can help you. And that's why you need to have randomized controlled trials. Now, there are, again, some notable side effects, potentially dizziness, sleepiness, headache, nausea, GI upset, and rare cases of liver injury. And then I guess because it sort of tries to limit your cortisol production, some people will have emotional blunting or have difficulty feeling pleasure in normal activities that they used to enjoy. You want to be careful using it with anti-anxiolytics as well as blood pressure medications, and avoid it if you're immunosuppressed, type 1 diabetic, have thyroid disease, or are on blood thinners or have a bleeding disorder. It's also considered a nightshade plant. So if you're allergic to that category of plants, which would be things like tomatoes, eggplants, potatoes, and peppers, you want to avoid this one. So bottom line, after reviewing all this data, I would say that while there is some reasonable data, a lot of it has a lot of bias and maybe was not powered appropriately, and they're pretty small studies. And I would say the most robust evidence is probably with L-arginine or L-citrulline. However, I think that this is going to work best for patients who have mild to moderate erectile dysfunction, not severe ED. And the reason I say this is because when we looked at the changes in IIEF scores, most of them were between 2 and 5 points, which again, you're only going to really see a benefit if you have mild to moderate ED. If you have severe ED or even moderate ED, you're probably going to need pharmacologic treatment or something additional to see a meaningful difference. Thank you guys for joining me on today's podcast. If you are enjoying this, please do me a favor. All it's going to take is a couple minutes of your time. time is please go on Apple Podcasts and leave me a rating or review for the podcast. It is a free, zero cost way to support the podcast, and I will greatly appreciate it. Also, if you want to interact with us on Spotify, please feel free to leave comments there. It's really helpful to see the things you want to learn about so I can make more content that you enjoy. Also, make sure you subscribe to our YouTube channel. This summer, I am going into a deep dive into testosterone supplementation, particularly dietary supplements that can help with testosterone. And so I think it's going to be really helpful and interesting. If you found this helpful, you will similarly find that helpful as well. And as always, remember to take care of yourself because you're worth it.